Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A special edition of Health Matters, a partnership between GoLocal and the Warren Alpert Medical School at Brown University. I want to welcome Mark Sigman, physician at Lifespan at the Warren Alpert, as well as heads up the practice of Brown Urology. Dr. Sigman, thanks so much for joining us.
Thank you for having me.
So lots of news in healthcare. Let's go at the broadest level. It's Men's Health Month. Men are not great at seeking medical advice, not good at almost any aspect unless they are injured on a field, I think. Talk a little bit about the month and what physicians like yourself in your practice are trying to communicate to America's and Rhode Island's men.
Sure. It's been known for a while that men don't listen well, and not just to their partners, but in terms of their health. And if you look at a variety of general health measures, out of the top 10 causes of death in the US, on the 9 of them, men die more frequently of these causes than women, whether it's heart disease or you go down the list. And much of that's reflected that they don't tend to seek medical care unless, as you said, they may not have a choice. And that often is too late to avoid bad consequences. I'm a urologist by training, specialty in the urologic aspects of men's health, but I work with internists that deal with other medical issues. And having done that has really brought to light this discrepancy in men's attitude towards preserving their health versus women's. And it's clearly been neglected by the medical profession as well as by the patients. And that's something that we certainly have tried to reverse that by emphasizing to men that many of the things that they do for lifestyle will have beneficial effects in improving their health overall and decreasing the mortality for some of these top 10 causes.
Is it just the behavior of the gender that men are, thought to be strong and work through the pain from sports and get back on the field? Is it that sort of constant narrative that takes place over the course of their lives that makes them feel this way? Or is it their inability to listen to others?
I suspect it's a little of both. Some of it's societal as to what their position is and how they're supposed to appear. There certainly may be some genetic causes. There are different genetic differences between men and women, and some of these may be genetic, but certainly much of it's lifestyle. And particularly the things when you're talking about, type 2 diabetes, which is related to obesity, diet, smoking, those kinds of things seem to be more of an issue for men on average, but they're an issue for everyone. But men seem to be more problem in that regard than women.
You have recently, you're running Rhode Island's, not only Rhode Island's, but New England's largest independent urology group, just gone through an acquisition, all during the period of time of the coronavirus. Talk a little bit about the complexity of running a health practice right now.
Sure. It has been a learning experience for many of us. The traditional model, having patients come into the office, you're often running behind, they're packed together, and you see everybody in person. And that's been the expectation both of the providers and of patients. And that had to be completely reversed in a very short period of time. We had talked about doing televisits or visits that you do by the internet with video and phone, and it hadn't got to the point where we're doing it. A lot of reasons for that, one of which, of course, it wasn't supported by the insurance companies. You weren't allowed, if you're a specialist, to have those visits. That was promptly changed in Rhode Island and most other states. And that gave us the ability to rapidly switch. Fortunately, the technology that we'd used for our electronic record had within it this televisit capability. And within 1 week, we were able to stop seeing the majority of non-urgent patients, and then within a week, start having these televisits. And what we've discovered is for many, not all, but many of the issues that we see in urology, we can do remotely. We don't always have to examine the patients. Now, that's not everything. And I think we will learn over time what percent do we need to see actually in person? But even if it's 30%, 20%, it will allow us to maintain some of the lessons we learned with COVID, decompressing the office, um, spacing out patients when they come in, having the healthcare providers not all bunched together, seeing patients all at the same time. Having had to do this acquisition occurred during the middle of the pandemic. Now, fortunately, it had been in process for many, many months before we even heard of COVID-19, before it existed. So much of the process was already in place, but the lessons we were learning, we were able to then sort of pass throughout the whole system of our practice and make sure at least there's some uniformity to this approach so everybody doesn't have to invent the same wheel every single time.
You know, I jumped to that because isn't there also the potential of getting men more likely to engage in better care if they can do it from a remote location, when they can control it? They don't have to take, you know, the male psyche of leaving work, going over there, being in a crowded waiting room, etc. That this may actually be potentially a spark to identifying issues, getting more engagement earlier on with male patients.
I think you're absolutely right. We're hoping that it's going to persist. Right now, many people have time on their hands because they haven't been working. And it's very easy to call up on the phone or by their iPad or smartphone or whatever. And I think what we've learned is it is convenient both for the provider and for patients, and they're more likely to get the follow-up. One of the biggest problems that I think many providers have is a patient may present with a problem, and then you say, well, maybe we need to look and do a test for this, and we'll follow up, and then they don't follow up. They can't take the time off from work or whatever. Now, instead of spending 2 hours because you have to drive there, wait in the waiting room, and then go back to work, and you're missing several hours of a day, you might miss 15, 20 minutes. And most people can somehow get that time away without disrupting their regular activities. And I think for the whole healthcare system, that's a promising thought.
Yeah, you know, it's interesting. We've worked with physicians for years, and in previous careers that I've had, you know, physicians' offices were not the most technologically advanced. In a matter of just 60, 90 days, everyone in the world functionally was forced to become digital like that in order to stay in business, and physician's office being one of them. This has the opportunity to create a whole new relationship and a much easier dialogue and constant dialogue between a practice like yours and its patient base.
That's absolutely correct. Currently, there's two basic formats for these remote visits. One is what we are doing today. You're streaming video and audio. And that requires, depending on the electronic platform, some sense of computer savviness with both the providers and the patients. And in some cases, that doesn't work well. Fortunately, we have the backup. You can just use a plain telephone. And the telephone works well for certain things. I think for many providers, seeing the patient, looking at their reactions is part of the evaluation process. So overall, I think the video is better, but at least we have a backup because some of the patients just can't get it to work. And it may have nothing to do with the technological savvy. Sometimes it's the device they're using. There's some bug in it and it just doesn't work. So having a backup is quite useful, and it gives us the opportunity at least to continue these kind of visits when the high-tech portion isn't working.
What would you say to men who are watching this or their partners who are watching this on why this month is a good refresher into for men to take care of themselves? What's that message you want folks to hear?
Well, I think there's sort of two. This month, being still within the pandemic, we're seeing an aggravation of some of these health concerns that men have had for a while. They're not working, they can't go to the gyms are closed, they're gaining weight, eating and watching TV, all the things that don't lead to a healthy lifestyle. So maybe emphasizes that you need to come up with a lifestyle where you are doing the healthy kinds of activities, regardless of what circumstances you're in. I think having a Men's Health Month gives us sort of a platform to try to focus messaging, and hopefully people might listen. Normally, we do other activities, which we're clearly not doing because they tend to be group activities with presentations, and we can't do that. This kind of platform lends itself very well to getting the message out that men, you do need to take care of your health.
We always give our guests the last word. What is the number one thing men should know this month, and what are you urging them to do?
I think the simplest message is there's no magic to becoming healthy. The kinds of messages you've heard all your life: eat well, exercise, limit things, cigarettes, alcohol, that leads to improvement in many aspects of your life. Some are urologic, some are just general health. And that's not difficult. It just takes a little bit of effort on the male side.
Dr. Sigman, I want to thank you for taking the time. I feel like I need to, for the rest of the month, have you as the second half of the 12 noon broadcast, Dr. Fine on the COVID, have you on Men's Health for the second portion of it, because we know how hard it is to get messages to blockheads like me who don't always do exactly what the physician recommends. So I really want to take a moment to thank you for taking the time, and please keep us up to date on any research you see or any information that you think Rhode Islanders need to know. For everyone else, we'll be back at 12 noon with Dr. Michael Fine. He'll be discussing some new research and also a strategy being done in Israel to interact with those and limit the spread of the COVID-19. The governor is not having a press conference on Tuesdays and Thursdays anymore. Do take a look at an article on GoLocal about our effort to identify, that's been going on for 3 months, identify some data on the modeling here in Rhode Island. But Dr. Sigman, thanks so much. For everybody else, please, please stay safe.